I've actually had a great time here at St. Joe's, and this is my second year at St. Joe's. So I came here as a PGY2 resident, and that's in the program when we would do adult, general adult, outpatient and inpatient psychiatry. And so my year this year, stepping into a more leadership and education and administrative role, has been fantastic. I already knew the hospital, I knew a lot of the people in the hospital, I was really familiar with a lot of the patient population that we see here, and it's been great. I think St. Joe's is a really welcoming environment. It's got sort of the best of an academic site and a community site, so it's very much a community health center, but at the same time it's affiliated with U of T. All of the staff that the residents interact with in the psychiatry department work closely within sort of the U of T system, and we get great supervision from the staff, and so you're connected with the university, you're connected with sort of what's going on and what's up and coming, and at the same time you're really embedded here in the community. Residency is a really interesting time. You've shifted away from being a more novice learner in the medical system, and you're really taking on a lot of responsibility. And so it's also the time that you start to think about, what do you want your clinical practice to look like? How do you want to practice? And then you've also got to start incorporating a lot of things like skills for continuous and lifelong learning. You have to incorporate skills around evidence-based medicine, and then also practical day-to-day things like, how do I balance this kind of work with the rest of my life and my other obligations? And so figuring out how to do that and really having a great group of mentors and clinicians who are able to show you sort of the ways that they've done that is something that's really, really important, and I think that's a major part of what happens when you're transitioning through residency. With respect to the having residents in a hospital site, I think you bring a lot of energy. The residents are going to have a lot of up-to-date information, a lot of up-to-date knowledge. They're also very enthusiastic about trying to be able to apply that information that they're learning. The things that they're learning a lot of times are going to be pretty cutting edge, and they're trying to figure out how to start applying that in a clinical setting and how that's actually going to play out in people's day-to-day lives. It brings everyone into an idea that we're all learning together. So whether the patients are learning, we're learning from patients, we're learning from staff, the staff are also learning from residents. It's more of a community kind of a feel, and how are you going to try and make things better, and how can you make sure that you're doing the best, you're providing the best possible care. And so I think that really ends up translating forward to patient experience. You also get residents tending to ask more questions, so things that might have been happening because that's always the way it was. When you've got a new set of learners and a fresh set of eyes, you've got people sort of saying, why does this have to be this way, or why is it this way, and is this the best way? And so then you get a certain kind of innovation that happens when there are residents around.